Good afternoon. My name is Mike Reynolds, and I'm going to be presenting on Marfan syndrome. Marfan syndrome is a genetic disorder that affects the connective tissue throughout the body. It is estimated that 1 in 5,000 people worldwide are diagnosed with Marfan syndrome. Marfan syndrome can have various effects on multiple systems throughout the body. This can include the skeletal, cardiovascular, and the ocular system. The genetic disorder is an autosomal dominant genetic disorder. It is caused by mutations in the FBN1 gene, which is located on chromosome 15. FBN1 gene produces fibrin 1, or protein, called fibrin 1. Fibrin 1 is a glycoprotein, and it plays a crucial role in forming connective tissue. Individuals with Marfan syndrome have a mutation in this FBN1 gene. This leads to abnormal fibrin 1 production, which affects the structure and function of connective tissue. If you're looking over here to my left, you'll see a healthy person and a person affected with Marfan syndrome. This would be their chromosome, and this would be the fibrin 1 gene that is being produced. Now, this gene, if it is a working gene, will then produce working fibrin 1 protein. When the protein is working, those proteins will join together to produce a very strong sheet of fibers within the connective tissue. This allows the connective tissue to function as normal. Down here, a person that is affected with the Marfan syndrome, you can see the affected gene on that chromosome. Now it has a mix of working and non-working fibrin 1 genes. From there, the altered genes will produce altered or not enough fibrin 1 protein. The altered or lack thereof fibrin 1 protein will then have a very weak sheet of proteins. That connective tissue will also be very weak, and then those characteristics of the disease will be displayed. Moving on to those characteristics that were just mentioned, some of the main characteristics of Marfan syndrome include a tall stature with long limbs, hypermobility and flexibility in the joints. Now that's joints and joint capsules all throughout the body. Cardiovascular abnormalities such as aortic aneurysms, scoliosis, and some lens dislocation as well. It is important to note that the features of Marfan syndrome can vary significantly among individuals. Not everyone with Marfan syndrome exhibits all of the characteristic features, and the severity can differ from person to person. On this next slide here, if you're looking at the image, this is a typical image or picture presenting what somebody with the major characteristics of Marfan syndrome will have. They will have very long limbs, very long and slender fingers and toes. You'll also see that the body is disproportionate and just does not look very normal. Very tall, very thin frame, very long arms, long legs, long fingers. Now, I've highlighted the more serious characteristics of Marfan syndrome as well as the more common characteristics of Marfan syndrome. Cardiovascular features do tend to be the more serious, specifically the aortic aneurysms that can be caused from the overly elastic connective tissue in that aortic valve. That'll cause a ballooning in that tissue, which will cause that aneurysm to form. We can also find some issues where the valves between the left atrium and ventricle tend to be a little too elastic, and that do not allow the flow of blood in and out of the heart properly as well. This could lead to heart attacks or, again, aneurysms in the heart. The more common characteristics of Marfan syndrome tend to be the skeletal features. As mentioned, those are the tall and slender builds, the long limbs, which is all due to all due to overgrowth in the connective tissue of the bones. The mode of inheritance for Marfan syndrome is that autosomal dominant pattern. This means that one copy of the mutated FBN1 gene is sufficient enough to cause the disorder. Each child of an infected individual has about a 50% chance of inheriting this disorder. Looking at this further, on the next slide, you'll see a pedigree illustrating the autosomal dominant mode of inheritance. Looking at this here, you can see the first generation, the parents, we have one affected parent, one unaffected parent, both having two affected children. Now, with the affected children, they both have a partner that is unaffected, producing both affected and unaffected children. If we look into the third generation, we can see an unaffected child is with an unaffected partner, producing unaffected offsprings throughout that generation. Sliding over here, we do have an affected offspring that is now mating with an infected partner. That those both being infected will be producing both affected and unaffected offspring throughout. Moving on with the presentation to the genetic testing options. Now, with Marfan syndrome, the main testing option is DNA sequencing of that FBN1 gene. This will test for any mutations throughout that gene. To the left here is the Marfan syndrome panel. This is a test that I highlighted that is in addition to your standard DNA testing kit. Now you can add the Marfan syndrome panel, which will specifically test for that Marfan genetic disorder. This is, again, added on to that normal DNA test, the 23andMe test that you can buy online. The test with the Marfan syndrome panel altogether is around $300 for that test. Now, you do not need a doctor's prescription or doctor's orders to have this testing done. Anybody can go and order this test. Some of the benefits for this include early detection. Early detection really allows for you to facilitate the proper means and modes of dealing with this disorder, getting all of the proper doctors together to work together to help pinpoint the characteristics of the disease that you are dealing with and help mitigate some of those so where you're able to live a somewhat normal functioning life. Now, with the benefits here and the early detection, you can also have more personalized treatment plans tailored to your specific mutation. This also allows for family planning. This is a genetic disease that can have some very serious effects to the offsprings of parents. So parents knowing that they are a carrier for this disease could make future planning for their families based on if they are willing to pass this or risk passing this genetic disease on to their offspring. Some of the challenges that come with genetic testing are the variability of the mutations can make it challenging to identify all of the possible mutations. We can find somebody with one mutation or we kind of stop at that and we forget to continue to test onto that, or just the broad spectrum of some of these mutations can cause a gap in the testing, if you will. Now, there are also some ethical considerations to think about here as far as the psychological impact on knowing that you do carry this genetic disease. And we also do have, as mentioned in the last slide, it is very important to have collaboration between all of the doctors, providers, and healthcare workers that are needed to mitigate this genetic disorder. It can be rather challenging trying to coordinate with those group of healthcare workers. So, in conclusion, Marfan syndrome is a genetic disorder affecting connective tissue. It's caused by mutations in that FBN1 gene, and it follows an autosomal dominant inheritance pattern. Genetic testing can help in the diagnosis, management, and mitigation of this syndrome. Thank you for your time.